Welcome to the deep dive. Today, we're tuning into the really interesting world of vibroacoustic therapy. You might hear it called VAT.
That's right. And we've got some great material to dig into. So from the VibroAcoustic Therapy International Certification course, some info from In Harmony Interactive.
Oh, and also an excerpt from the musical brain that talks about the vagus nerve, which sounds fascinating.
Yeah, it all ties together. So our mission today, basically, is to give you a really solid but, easy to grasp understanding of VAT.
What it is, how it's used, what you need to think about if you're curious, getting you the essentials.
Exactly. So at its heart, vibroacoustic therapy, VAT, uses sound waves, specifically these really low-frequency vibrations, usually between, say, 30 and 120 hertz.
30 to 120 hertz. That's really low, like a deep hum or rumble you'd feel.
Pretty much. Sometimes they explore frequencies outside that range too, but that's the main zone. And the core idea, everything vibrates. The whole universe, even our bodies, right down to the cells.
Okay, wow. So the theory is our bodies have a natural, healthy vibration.
That's the concept. And VAT aims to sort of restore that healthy resonance when things get out of whack.
So like tuning an instrument. If stress or illness throws us off key, VAT helps tune us back.
That's a good way to put it. And it's not just about the frequency number itself. Something really important seems to be the mind-body connection that gets stronger during therapy.
Ah, okay. So it's the whole experience, not just the vibration hitting your cells.
Right. That link seems crucial for effectiveness. It's creating the space for your body's natural retuning to happen.
And it sounds like it's not one size fits all. Our sources mention things like, well, if you live near a noisy highway, that constant sound might change how you respond.
Absolutely. We're always interacting with sound. So a good VAT practitioner looks at those external things, your health, your lifestyle.
And then figures out the best frequencies and schedule for you. It's personalized.
Very much so. And this isn't brand new either. People like Olav Skill, Dr. Heidi Ahonen, Dr. Jeffrey Thompson, they've done foundational work here.
Laying the groundwork for understanding how these low frequencies affect us. Okay, so let's get into the specifics. How are these frequencies actually used? The range of conditions seems huge.
It really is fascinating. Take something simple like colic or constipation in babies.
Okay.
Frequencies around 35 to 45 hertz are often used. Parents sometimes report relief pretty quickly when the baby's just lying on them on a vibrating lounge or mat.
35 to 45 hertz. Like a deep purr, you said. Gentle.
Yeah, very gentle. Then you have something like ankylosing spondylitis, that condition with stiff muscles.
Right.
There, it's mainly 40 hertz, sometimes 60 hertz. The hope is it reduces that morning stiffness. But importantly, they say stop if there's active inflammation.
Makes sense. Don't vibrate something that's already inflamed. What about breathing things like asthma?
Yeah, important point there. VAT isn't a cure for asthma, but it can help.
How?
Using multiple frequencies, maybe in the 40 to 75 hertz range, seems better than just one frequency, like 50 hertz. It can help loosen lung secretions, make breathing feel easier.
Like a gentle internal massage.
Kind of, yeah. And for some people with severe issues, having VAT at home might offer quicker relief when they need it.
Interesting. And for aphasia, the language issue after a stroke.
That often involves multiple frequencies, too. Maybe start low, around 40 hertz for relaxation, then move up to, say, 68 to 80 hertz. It's often used alongside regular speech therapy, kind of stimulating different areas.
A specific sequence. And autism, is there a frequency for that?
It seems less about a specific frequency there and more about using the sounds and vibrations as a tool.
A tool for what?
To help increase comfort with touch and sensory input. Maybe build that client-therapist connection. They often gradually decrease the sound level while focusing on the relationship.
Okay, shifting gears,
Yeah.
bed sores. How does vibration help there?
The idea is consistent, gentle vibration, maybe 35 to 43 hertz daily for a month or two, might help stimulate blood flow and tissue repair.
Lying face down if the sores are on the back, the notes say.
Right, and they make a really strong point. Even if it helps diabetic ulcers, VAT is not a treatment for diabetes itself.
That's a critical distinction. Keep the condition and the symptoms separate. What about stroke recovery in general?
It's often used for broad sensory stimulation, maybe before or after physio. Different frequencies work, but 86 hertz has shown promise for some.
86. That's getting higher.
It is. And they warn to start really low with that one to avoid an unpleasant firing or overstimulation feeling in the nerves.
Good caution. And cerebral pulsing.
Around 40 hertz is explored there. Potential to reduce spasms, maybe improve mobility. Again, that gentle coaxing idea.
It seems like those lower frequencies, maybe 30, 50 hertz, keep popping up for physical stuff like circulation issues.
Yeah, definitely. Cold hands and feet, leg ulcers. That 35, 50 hertz range is common. Some people actually feel warmth during or after.
Which would make sense if blood flow's improving.
Exactly. But again, not a diabetes cure.
Well,
We also see 40, 45 hertz and 50, 56 hertz for colic pains, often with fast results.
and then way at the other end, coma. That sounds intense.
It is very specialized. They use big contrast, very low and very high frequencies for strong stimulation, even something called a negative sound shock.
What's that?
Briefly turning off loud sound and vibrations to see if there's any facial or body response. Needs top therapists, doctors involved, definitely not casual use.
Wow. Yeah, highlights the need for expertise. Okay, what else is on the list? Constipation?
Yep, 35, 45 hertz for that. They suggest drinking water before and after, often relief comes the same, or next day.
Cystic fibrosis?
Similar range to asthma, 40, 75 hertz. Maybe less frequent treatment needed than asthma, though.
Emphysema? COPD?
Same range again, 40, 75 hertz. More for symptom relief alongside physiotherapy. Be ready for phlegm to loosen up, apparently.
Good to know. Fibromyalgia seems complex.
It does. Often starts with a single low frequency, like 35, 45 hertz, then moves to multiple frequencies, maybe 30, 86 hertz.
And the pain might get worse initially. Or move around.
That's what the course notes mention, which really underlines the importance of the client being relaxed and okay with the process. It suggests VAT might be, stirring things up to release tension.
Managing expectations is key then. What about headaches? Migraines versus tension headaches?
Very different approaches for migraines. Very low volume, high frequencies, over 80 hertz. And critically, no music, dim lights, no smells.
And timing matters. Earlier is better.
Seems so. Nausea is possible too. Tension headaches are different. Maybe 68 hertz if it's neck shoulder stuff, or 35, 50 hertz if it feels circulation related. Might need a series of sessions.
Okay, immune system support. Is there a frequency for that?
Not a specific program, no. The idea is more indirect, by reducing stress, improving sleep, lessening pain. Maybe that helps the immune system function better.
Makes sense. Insomnia.
Multiple frequencies, 30, 48 hertz. And they suggest treating late afternoon might be best, helping the nervous system wind down for sleep.
Kidney stones get a mention. 93 hertz. But with a big warning.
Huge warning. Absolutely not a substitute for medical care, just noted as something reported in positive cases. Drink lots of water afterwards, they say.
Low back pain, the muscular kind.
Around 52 hertz, maybe plus or minus 10%. Daily for a few days for acute sprains. For longer-term tension, maybe lower frequency sessions a couple of times a week.
Lumbago. Similar idea. Around 50 hertz?
Yeah, muscular overuse, not slip discs. Around 50 hertz, maybe adding 40 hertz and 60 hertz for longer therapy. Daily for acute pain.
Menstrual pain.
52 hertz again. Suggested use is the week before and mid-cycle. Interestingly, they note bleeding might be stronger but shorter. Long-term use might even help regulate cycles in PMS.
Oh, and for endometriosis, add 40 hertz at the end with guided meditation music. That's very specific.
It really shows how tailored it can be. For MS, multiple sclerosis, it's palliative for rigidity. Around 40 hertz, maybe alternating with multi-frequency, often needs ongoing long-term therapy.
Muscle cramps.
40 hertz and 60 hertz often dissolve quickly. For general neck-shoulder tension, 68 hertz is common, or 40 hertz if blood supply seems like an issue. Multi-frequency can help if pain initially increases.
But stop if it feels like inflammation.
Definitely. And they caution about treating muscle tension in clients with known mental health issues without checking with their doctor first.
Good point. Edema, swelling.
Around 40 hertz, but multi-frequency between 38, 48 hertz might be best, especially for arms and legs.
Parkinson's.
30 hertz is recommended, often double sessions for rigidity, palliative effect.
Polyarthrite.
35, 45 hertz for those smaller joints.
Post-op scar tissue stiffness.
Multi-frequency seems preferred. They even suggest a sequence, 40, 60, 80, 60, 40 hertz. Start higher if the surgery was very recent, though, over a week ago.
Okay. 52 hertz comes up again for PMS, Rett syndrome.
Under 60 hertz, palliative, often with physiotherapy.
Rheumatism, like rheumatoid arthritis.
Mainly 40 hertz, but be careful during flare-ups. For pain relief, maybe switch to multi-frequency like 40, 60, 80 hertz, but keep the vibration level low.
Spastic conditions.
Around 40 hertz, maybe up to 60 hertz, alongside physio. Start volume very low.
Sports injuries. Muscle traumas.
Multi-frequency, 34, 68 hertz. Lower for big muscles, higher for smaller ones. But not if there's bleeding.
Crucial safety point, Okay, stress. That's a big one.
Yeah, 68 hertz is often mentioned, maybe combined with multi-frequency. Sometimes use more activating music towards the end of a series of sessions.
And the therapist needs to be ready for emotional release.
Yes, the course highlights that. Need time to talk, need training to handle weeping or strong emotions. Also, warning about driving right after due to endorphins.
And distinguishing stress-related feelings from clinical depression.
Right. Endogenous depression is something for specialists, not general VAT therapists without that specific training.
Makes sense. Almost there. Varicose veins.
35-42 hertz might reduce discomfort, swelling, pain, pressure. Doesn't fix the veins themselves.
And whiplash. Only after it's stable, right?
Absolutely. And with Dr. Physio cooperation, treating secondary muscle tension, maybe 68 hertz for recent injuries, alternating 40 hertz and 68 hertz for older ones.
Wow. Okay, that's an incredibly detailed list of potential applications. It really covers a lot of ground.
It really does. And it's not just about the frequencies. Music plays a big part too, doesn't it?
Yeah, our sources talk about 3 main kinds of music used with VAT.
Right. The first is music actually made for VAT.
How's that different?
It's usually based on one main frequency and everything else relates to it mathematically. It often has this kind of floating feel, consistent rhythm, but nothing you'd likely recognize or have strong memories attached to.
Okay, so it doesn't trigger specific thoughts or feelings. The second...
That's more familiar. Relaxation music, instrumental stuff, classical, maybe new age, some popular tunes without lyrics usually.
Why instrumental generally?
Vocals can sometimes be distracting unless you're working with, say, dementia patients where a familiar song might actually help create connection. With relaxation music, they often tweak it, lower the high frequencies, boost the lows to deepen the calming effect, following principles of anxiolytic music.
Anxiolytic,
Yeah.
meaning anxiety reducing.
Exactly. Slower tempo, simple melodies, that sort of thing. Think Stephen Halpern, maybe some hemisync stuff. Kelly Howell's nonverbal tracks.
And a third category.
Basically just normal listening music. This might be used if the music choice isn't the main point, or if the client has really strong preferences, or maybe the therapist wants to use music with specific positive associations for that person.
So client choice and personal connection matter there. What about music with binaural beats, like some of those names you mentioned?
Yeah, Kelly Howell, hemisync, Halpern's oral sync. That stuff is great for getting into meditative states, but combining it with VAT, the sources say we need more research to really know how those interact.
That makes sense. 2 different ways of influencing brain states. Could be complex. Speaking of brain states, meditation seems like a natural partner for VAT.
Absolutely. The info suggests the vibrations can actually help people drop into a meditative state faster.
Easier to get centered and quiet the mind.
Seems so. The relaxation from the low frequencies, maybe even the subtle brainwave effects, can pave the way for a deeper meditation. And we know meditation itself has tons of proven benefits.
Like what? Remind us.
Oh, stress reduction, boosting creativity, maybe better sleep, digestion, potential effects on blood pressure, heart health.
Anxiety, pain perception, focus. Even brain size in some studies.
Right. It's a pretty powerful practice on its own.
And this leads into something really practical and interesting from The Musical Brain. Excerpt, conscious humming and toning, things you can do yourself.
Yeah, these are great self-care tools that tie in nicely. The key here is the vagus nerve.
The longest nerve connecting the brain to pretty much all the major organs.
That's the one. And humming or toning, making those sustained vocal sounds, actually stimulates it because of the vibrations in your throat and chest.
And stimulating the vagus nerve does what?
It helps shift you into the parasympathetic state. That's the rest and digest mode, the opposite of fight or flight. So it helps reduce stress, potentially inflammation too.
The book even mentioned the author's grandmother humming a lot through tough times and living a long life without dementia. Anecdotal, sure, but...
But it fits the idea, doesn't it? That humming could be a simple way to support brain health. The excerpt gives steps too. Breathe deep from the diaphragm. Focus your intention while you hum.
And toning is similar. Just using sounds like long vowel sounds.
Exactly. Same principle, stimulates the vagus nerve, helps with relaxation, breathing, stress, heart rate regulation.
And diaphragmatic breathing, belly breathing, is key for both.
Yeah, and for relaxation generally, they even mention box breathing. Inhale 4, hold 4, exhale 4, hold 4. Super simple way to calm your system down quickly.
So VAT is like the external tool, and humming or toning are internal ways to get similar calming, vagus nerve stimulating effects.
You got it. They complement each other well. Now, thinking about actually having a VAT session, there's some important practical points.
Right, this certification course stuff. Like, practitioners shouldn't call themselves medical professionals. Use clients, not patients.
Exactly. It manages expectations and acknowledges VAT often addresses well-being beyond just diagnosed medical conditions. They even suggest having psychotherapists to refer to if deep emotions come up.
Makes sense. And before you even start a therapeutic session, not just relaxation, that intake interview is vital.
Absolutely crucial. Need to choose the right frequencies, but also screen for contraindications, things where VAT might not be safe.
What sort of things are definite no-goes?
The list includes acute thrombosis, blood clots, active inflammation, a very recent slip disc, acute whiplash, recent head injuries, any active bleeding.
Also, psychotic conditions, severe neurosis, really low blood pressure, a very recent heart attack, and pregnancy.
Right. The advice is always, if in doubt, have the client check with their doctor. Better safe than sorry.
Are there precautions too? Things to be aware of?
Yeah, like warning clients with diabetes, they might feel something like an insulin effect, even though V8 doesn't treat diabetes itself, just so they're not surprised.
And tracking the response is important. Pain scales, blood pressure, movement range.
Yes, measure before and after. But again, the practitioner shouldn't be diagnosing or claiming cures. It's about tracking the client's experience and physiological response.
What about the session environment itself? What's it like?
For a first-timer, it helps to explain the sensations, emphasize it's their personal journey, connecting with their body, start the frequencies low, increase slowly to comfort.
Encourage them to just pay attention to what they feel.
Exactly. Then usually leave them alone, but within earshot for the session, typically around 23 minutes.
And afterwards.
Gentle reentry. Maybe offer some alkaline water or water with lemon. Give them space to talk about it if they want. Remeasure pain, blood pressure, whatever you tracked before. Make sure they feel grounded before leaving.
What about music during the session? We talked about types of music.
Generally, unfamiliar or soothing music without a strong beat is preferred. You don't want the music fighting the VAT frequencies, unless it's someone with, say, Parkinson's or Alzheimer's, where familiar positive music can actually be really helpful for connection and memory. Oh, and biofeedback during VAT. Generally not recommended.
Okay. How many sessions does someone typically need?
It really varies. Serious or chronic issues might need an initial series, maybe 5 to 20 sessions. Parkinson's, COPD often benefit from ongoing maintenance.
And headaches might get worse before they get better.
Sometimes, yeah. Good to warn people. And while getting too much in one 23-minute session is unlikely, watch for signs like cold sweats, dizziness, faster heart rate, anxiety, or new muscle pain. Stop if that happens.
And that initial pain increase in fibromyalgia could be okay, but persistent local pain needs checking for inflammation.
Right. It's all about careful observation and a client-centered approach.
So we've covered a lot of the what and how. Let's touch on the why. What's the science behind VAT making these changes?
Okay, yeah, this is fascinating. On a really basic level, think Einstein, EMC how. Sound, frequency, vibration, it's all energy. And energy and matter are linked.
So our bodies are energy, vibrating particles.
Essentially, yes. And each organ, each tissue, seems to have its own natural, healthy vibrational rate, its resonance. VAT is trying to help restore that optimum resonance when it's been disturbed.
And didn't you mention Candace Pert's idea about sound opening cell receptors quickly?
Yeah, that's a powerful concept. Suggests sound can interact directly and rapidly with our cellular workings. Plus, our bodies are mostly water, right?
Right.
Sound travels way faster and more efficiently in water than air. So our bodies are great conductors for these vibrations. It's like a direct line of communication.
To the nervous system, bones, muscles, fluids, like a cellular massage.
That's a good analogy. It can trigger the relaxation response. Think slower brainwaves like alpha and theta. And it promotes beta endorphin release.
Natural painkillers.
Exactly. It might also calm down overexcited motor neurons, which could explain why it helps with spasms.
And the increased blood flow and warmth we talked about.
That too. Plus, it seems to positively influence stress hormones, beta endorphin, ACTH, cortisol, helping bring that system back into balance.
How does it reach the brain?
Through nerve pathways in the spinal cord that sense vibration. That data goes up to the brainstem, cerebellum, limbic system, emotions, even the cortex thinking.
Is the goal to get everything vibrating at the same frequency, like entrainment?
Not necessarily. Different body parts might respond differently. That's why VAT often uses varied frequency programs, not just one steady tone. It's more nuanced.
And it's different from music therapy.
Yeah, sound therapy, like VAT, is about the direct physical effect of the sound waves. Music therapy focuses more on the therapeutic relationship, using music as the medium. VAT can work even if someone can't consciously process music due to cognitive issues.
Feels like it connects to really old ideas, too. Pythagoras and musical maths, ancient shamanic sound rituals.
Absolutely. There's a long history of using sound for healing and altering consciousness. VAT is a modern, technology-assisted version of that ancient wisdom, in a way.
And the VAT frequencies, 30, 120 hertz, where do they sit compared to brainwaves?
They overlap with the upper end of alpha, relaxation, and into beta, alertness, focus. It's an interesting intersection.
What about those patterns sound makes in sand? Chladni figures.
Yeah, or Hans Jenny's cymatics work. It shows how sound can literally structure matter. Since our bodies are made of similar stuff, water, minerals, salts, it's easy to imagine how vibration could have a structuring, organizing effect internally.
A powerful image. The sources also mention no-gear frequencies and the Schumann resonance.
Briefly, no-gear frequencies are much higher than VAT. But the Schumann resonance, Earth's natural frequency around 7.83 hertz, is much lower. Its importance for health is highlighted by NASA using generators for it in space.
So frequency matters, and intensity. Sound can heal, but it can also harm, right? Like the Tacoma Narrows Bridge vibrating itself apart, or Ella Fitzgerald breaking a glass.
Exactly. Sound is powerful. VAT aims to harness that power carefully using specific low frequencies at controlled intensities for therapeutic benefit.
Okay, so wrapping this deep dive up, let's crystallize the key insights. Vibroacoustic therapy, VAT, is this really fascinating kind of multifaceted approach.
Yeah, it uses specific low-frequency sounds vibrations, tapping into that fundamental mind-body connection.
And we've seen it applied to just a huge range of things. Physical pain, stress, circulation, breathing issues, even neurological support.
The core ideas are resonance, that natural healthy vibration, and the body's ability to respond to and potentially retune itself with these sound waves.
Music can definitely play a supporting role, enhancing the experience.
Yeah.
And we touched on things you can do yourself, like conscious humming or toning, to tap into similar principles.
And hopefully for you listening, someone who likes to get knowledgeable quickly but deeply, this gave you some real aha moments. We tried to give you a clear picture of VAT, its uses, the thinking behind it, without getting you lost in the weeds.
We covered lots of specific examples showing just how diverse the applications are.
Yeah.
A solid, accessible overview. So here's a final thought to leave you with. We know vibration is fundamental. It's in the universe. It's in us. If we really leaned into understanding sound and resonance more deeply, how could that genuinely revolutionize how we think about health, about well-being in the future?
And maybe more personally, after hearing all this, what kind of explorations with sound or vibration might you feel curious to try out for yourself? Something to think about.
Definitely. Thanks for taking this deep dive with us today.